Welcome, everyone. Happy Friday afternoon. I'm Maggie Gunther Osborne. I'm representing United Philanthropy Forum as one of the co-sponsors of today's conversation. I'd like to kick it over to two of United Philanthropy Forum's partners and members. Christine or Vince, go ahead.
I'll jump in, and apologies, it is noon here on the East Coast, so that is church bell time next door to my apartment. So while I'm speaking, hope you enjoy a few chimes. I'm Kristen Purdy, Executive Director of the Funders Committee for Civic Participation. And at FCCP, we believe communities should have the power to make a difference on issues that impact their lives, and that there shouldn't be structural barriers to participation, but rather an open and equitable democracy. Our members have been dedicated to supporting the infrastructure needs to achieve this vision on all matters around civic engagement, from the election to the census and any other needs that arise in our community. And that's why through our Funders Census initiative, we've helped mobilize philanthropy around the census with a focus on historically undercounted communities. For our network, the census has been a strategy to achieve these ideals, break down silos between national and state funders, strengthen philanthropy's advocacy muscle, test models of grant making, and broaden the network of democracy funders. We're so grateful to all of today's co-hosts and speakers for partnering with us to put these recent learnings and civic infrastructure connections into a broader, lasting context.
All right, and I'll pick it up. Thank you, Kristen. I'm Vince Staley, Executive Director of Media Impact Funders. And it's exciting to be doing this in Infrastructure Week. It's finally here. And as Washington is grappling with the definition of infrastructure for our national economy as a whole, we're also exploring today the notion of civic infrastructure. So it may seem obvious to our co-sponsors at the Funders Committee and also Grantmakers and Health, for example, that they serve to build civic infrastructure for funders concerned with civic participation around issues of census and electoral engagement, and obviously for health funders around efforts to promote access to and confidence in the vaccines that are helping us to defeat COVID. But it's equally true that funders who support media of all types are also contributing to civic infrastructure through support of local journalism, public media, ethnic media, and all forms of community media that helps to inform community members. And ultimately, a vibrant media ecosystem is a critical foundation for a healthy democracy. And so with that, I want to turn next, we're going to have a brief presentation from Karthik Ramakrishnan, who is from Census Legacies. Thanks, Karthik.
Thank you, Vince, and thank you, everyone. Eric, if you can bring up the slide deck, please. So first, we have an example of Census Legacy's work in Imperial County. Go ahead, Eric.
This is where we came and we set up. We brought a person that sells snow cones, and then we also caravanned. We went in cars and we drove around the town, making noise, honking our horns, and telling people, go get a free snow cone, complete the census. And then we would ask them if they understand what the census count is about and how it can help their community.
Imperial County is the southeasternmost county in California. It borders Mexicali. It also borders Arizona. We're a mixture of Coachella Valley with a little bit of border and a lot of ag.
Because completing the census really determines a lot of the political arena, like I was saying, and the districts, I really think this time to get people to complete the census, or at least our young students or anyone really of demographics, was really understanding that if you complete the census, you can be so much better represented and our community will get more money. And that's why we also said why we completed the census.
Well, because once you see, even myself, when I see numbers go up a little bit, just even 1 or 2%, I mean, I'm like, oh man, that's great. So what do? Wake up in the morning and post something, and try to help out.
If it weren't meant for the census itself, we never had this conversation. We're never, touch base with each other, see what other programs that we're doing besides the census. And I think for me, that's one of the greater successes,
As many barriers as we experience, we are committed to come to the table and do what we can for this community. And that from a statewide perspective, it doesn't happen that well in larger communities as well as it does here. And frankly, that makes me very proud to be from Imperial County and just extremely grateful for the support.
We have in Imperial County abundance of land, a lot of natural resources. We also have resources like lithium that are used for batteries. Companies such as, I believe, Tesla need this resource. So we do have a great amount of assets. It's just about investing in this community to ensure that we are living to our fullest potential.
This is where we
So thank you, Eric. So Census Legacies. What is Census Legacies? It's a little bit grainy here. Hopefully the resolution will get it better. Census Legacies is an initiative that builds on the foundation of census coalitions to create stronger, more inclusive, and more equitable communities. We're a growing network of funders, nonprofits, businesses, government agencies, and others who participated in census. And we're trying to repurpose those outreach tables to ensure that historically undercounted communities have an equal voice in shaping the future of our regions. Next slide. This is our advisory group, and we have representation from philanthropy-serving organizations, philanthropies themselves, business associations, nonprofits and nonprofit coalitions, government agencies, as well as other census experts. Next slide. So here are the key insights that inform the work. And this should be familiar to many of you who were either involved in census or in COVID work or in vaccine equity work or all of the above. One is the importance of trusted messengers, especially when trust in government is low and varies by partisanship. It is the nonprofit sector that is so critical to make sure that we are engaging communities in the ways that we need to engage them. Another key insight is that community input needs to be all inclusive. So it's not just about one particular type of community, but all communities of color, indigenous communities, immigrant communities, LGBTQ+ populations, people with disabilities, veterans, and more. And then finally, these solutions need to be co-designed, right? So instead of governments thinking of community partners as those that they contract with to deliver on particular services, or philanthropy having a similar kind of mindset, instead of thinking of community organizations as delivery mechanisms, to recognize them for their expertise and to be at the table together and co-designing solutions together. Next slide. One additional insight that has come out of our census work is to avoid the 10-year boom and bust cycles in community partnerships. So similar to what we found in the civic engagement space, where you see this boom and bust cycle in presidential election years, you have a lot of funding, midterm years, you have some funding, but not as much. But in between those election years, there is no funding for civic engagement. What the field decided a few years ago is to invest in what is known as integrated voter engagement. Right, so it's not the same level of resources as you might see in terms of the flood of money that comes every 4 years, or in some places every 2 years, but still it doesn't go down to zero. Similarly, what we are calling for is for a model of integrated community partnerships that avoids that 10-year boom and bust cycle. Next slide. So one of the things we're doing as we move forward with the work, moving from census to COVID to vaccine equity, is to move away from that boom and bust mindset and really to get away from the mindset of thinking about community partnership as a series of program investments and to think instead about investments in infrastructure. Our definition, our working definition of civic infrastructure, we'd love to get any feedback either in the breakout sessions or when we come back together at the close of our event, is to define civic infrastructure as all of the organizational structures, networks, and partnerships that are necessary for a well-functioning society. So this is akin to the kind of capital investments in bridges, roads, and tunnels that we just heard from the president earlier this week. Just as those are important to ensure the efficient, effective, and equitable delivery of goods and services, we can think of the same when we think about our civic infrastructure. Next slide. So in terms of civic infrastructure, we can think about it in terms of components and assets, as well as the networked relationships and partnerships that make it all work. So in terms of components, we can think about government agencies and the importance of interagency coordination, vertical between federal, state, and local, horizontal within counties in terms of different agencies, such as health, planning, transportation, et cetera, and then horizontal across counties when you have regions, such as where we operate in Southern California, where we are seeing increasing horizontal cooperation. We can also think of community media as an important part of civic infrastructure, media that serve communities of color, that have expertise in communities of color, and also thinking about social media and virtual communities. Faith-based organizations are another important component. Nonprofits, whether they be service providers or advocacy and base building organizations. We can also think of businesses and their corporate social responsibility as an important part of civic infrastructure. Finally, we can think of our schools, libraries, and universities, and philanthropy as important civil society actors that are key to civic infrastructure. Next slide. So we have a visual here. So just as we think about the bridges that are essential to make sure that we have efficient and equitable delivery of goods and services, we can think of these key pillars of civic infrastructure that involve government agency coordination, community media, educational institutions, and then civil society. We don't have philanthropy specifically flagged, but philanthropy is part of that nonprofit sector. But of course, we can think about corporate charitable giving as well as part of that civil society. We argue that all of this is important, and we often take it for granted. Government government funding often takes the civic infrastructure for granted, and we need to make sure that we continue to advocate and actually increase investments dramatically in communities across the United States. Next slide. In addition to the components, it's also important to pay attention to the connectivity. So to think about how these components interface together in a network. It's important to pay attention to trust, both generalized trust as well as particular trust that's either partner specific or application specific. Say, for example, the kind of trust that you need on vaccine uptake, or the trust that you need in terms of getting people to fill out a census form. Another important aspect of connectivity is information sharing. Just because you are able to pull people together does not mean that they're sharing information in a timely manner with each other. Relationship building is also critical. Learning and persuasion as it works within these networks that are part of civic infrastructure. And then finally, we can think about the continuum of governance. If we were talking about marginalized communities, how do we make sure that they're not tokenized when they're brought in? How can we ensure that mobilization is not just episodic and that moves towards movement building and empowerment on a more continual basis? And then finally, how do we get to that place where we're talking about shared governance so that you don't have to constantly be investing in mobilization and movements, and where it's just baked in, where communities that have been formerly marginalized are integrated in all aspects of governance. Next slide. There's some promising examples that we have found in terms of moving from census to COVID to vaccine outreach, and we'll be hearing more about it in a panel shortly. But some of the examples that I'll lift up include Epicenter New York. This is a for-profit media effort that has gotten very heavily involved in vaccine planning and vaccine access work. In Philadelphia, you have the Philadelphia Philanthropy Network that was invested very heavily in census and has pivoted and is investing heavily in vaccine equity work. We're seeing similar examples in Chicago too, in terms of funders that got involved in census that are also doing vaccine equity work. Looking next at the state level, inspiring examples from Faircount in Georgia that has gotten very heavily involved in ensuring vaccine equity to make sure that vaccines are getting to folks and engaging in text messaging and other campaigns to building on what they were used to when it came to getting out the count. We'll be hearing from the Florida Civic Engagement Table shortly. We also have examples from the Miami-Dade Office of New Americans that were involved both in census work as well as vaccine outreach work. Houston in Action. Ventura County, this is something we just learned more recently, and I love this concept. They're creating what they're calling a complete reach committee. So they're going from their complete count committee to a complete reach committee. I love turns of phrases. So this is something that we're taking here in our region and seeing if that could work. And then finally, the Tri-County Community Partnership. We saw an example from Imperial County before. Imperial County has traditionally been one of the least resource counties in California, with a very sizable farm worker population that has experienced one of the worst COVID infection and death rates in the state. We are working hand in hand with Riverside and San Bernardino County. So it's that eastern region of Southern California, all coming together. And we've transitioned from census work to vaccine work. And we're starting to build into a future to think about affordable housing as the next major equity campaign to be working on. Next slide. So in terms of call to action, what we would call for, and this is just Census Legacies talking here, is to help change mindsets in philanthropy away from that boom and bust mindset or a campaign mindset or even a program mindset to think about investments in infrastructure. That will also require changing mindsets in government, as well as thinking about public financing for civic infrastructure. Some people may blanch at this notion that you have government funding media, but we have that at the national level with the Corporation for Public Broadcasting. There is no reason why we can't figure it out in terms of how do you get government financing for local media and avoid any kind of conflict of interest or remove the ability for media to serve as a check on government power. To learn more about Census Legacies, please visit our website. And I'm going to end there and turn it over, if you can go to the next slide, Eric, to Kara James from Grantmakers and Health, who is one of the co-conveners for the event today, who will be leading a moderated discussion with the names that you see here. Kara, over to you.
Thank you, Karthik, and good morning or good afternoon to everyone. It is my pleasure to be here. As Karthik mentioned, I'm President and CEO of Grantmakers and Health, and we are excited to be partnering with our partners here with Maggie, Vince, Kristen, and Karthik, and the Funders Committee for Civic Participation, Media Impact Funders, Census Legacies, and United Philanthropy Forum on this really important conversation. And I'm, reflecting as much as we have on the time that we're in right now and what we have learned with COVID and the importance of where you live matters. And where you live matters, as well as having importance of clear, concise, accurate information. We know that there are inequities across our society in every facet of our society, but we've also seen great partnerships come together to help communities to address their needs. And we want to figure out ways to continue to sustain and build on those partnerships to address future and ongoing issues that we have. And I think, infrastructure is a great way to do that. So I'm really looking forward to this conversation, and I'm going to tee you all up now that you can please chat your questions in the chat feature. We're going to have a discussion here with some of the experts who've been doing this work and thinking about where they're going next. And then we'll turn it over to take some of the questions from you all. So please, as we're going through this, feel free to chat those, and we'll get started. So I am so pleased to be joined by Juanita Fernandez, who is with State Voices of Florida, and Armando Carmona, who is with the Inland Empire Media Roundtable, and Courtney Stewart from the Missouri Foundation for Health. And I think you get three great perspectives and lots of information here. So let's dive in. And Juanita, I'm going to start with you maybe, and just really, take a moment to tell us a little bit about how your organization has been engaged in the census work, and a little bit about what you guys have done and who you are.
For sure. So hello, everybody. Thank you for having me. My name is Juanita Fernandez, and I'm the executive director at State Voices Florida. We're a 501c3 that just supports a powerful network of coalitions fighting for multiracial political power using data, civic participation, and grassroots organizing. Our table has over 94 partners, and it covers issues from the environment to social justice issues, reproductive rights issues, you name it. Our partners run the gamut. But our partners are laser focused on the work that they're doing, right? Oftentimes siloed. So the table kind of provides that 30,000-foot view so that those organizations that have been siloed can kind of see where their work is integrated. I think that gives us a really good space to be able to strategically coordinate how resources can be divvied up and provide those, shine lights on those opportunities of where we can kind of work together, because many hands make light work. So in terms of the census, we have been really fortunate to put together and be a part of a lot of great coalitions doing this work. The bottom line is we're lifting up the voices of marginalized groups, right? That is centered in our work. And so what we do see is since our efforts are focused on BIPOC communities, which often have low self-response rates and which are routinely and systematically undercounted, we're trying to make sure that we are including those people and focusing on communities and organizations that spotlight those communities and try to help give them the information they need. Undercounts and hard to count communities lead to fewer funds and resources. As you guys know, I'm preaching to the choir here, coming into the communities we serve. So what we've done is just allow each and every one of the organizations that we serve to do what they do best and kind of take bits and pieces of this work to see which would best fit their role, which allows us to say, like, we have some groups that are doing transportation, different aspects, and some groups that are reaching out to local farm workers, and some groups that are focusing on actual legislation. And so I think that is how the table helps serve the community in this way.
Thank you. And I think, really talking about the importance of addressing these issues at every level of our society, not just from, within the community, but working at policy level as well. So Armando, I want to turn to you and maybe talk to you a little bit to help us understand about the Inland Empire Media Roundtable and the work that you guys did.
Yeah, thank you, Kara, and welcome. And I'm really excited to be here with this group. My name is Armando Carmona. I'm a partner at Zunu Strategies, which is our consulting firm, but in one of the conveners of the Inland Empire Media Roundtable. In the last few years, specifically, we've seen huge transformations in the media sector across the country, and also in local community media has been specifically impacted. We've seen changes in coverage and storytelling. We've seen changes in the economics and the business infrastructure of media, and we've seen changes in the overall access and in terms of whose stories are being told across the country and in our communities. So the Inland Empire Media Roundtable was an effort to bring media outlets together, to tell a different story, to tell the stories of our community. The Inland Empire faces a number of challenges, both from its huge landscape. If you're familiar with either Riverside County or San Bernardino in terms of size, it's larger than many states. And in terms of a population, it's also comparable to many states around across the country. So we have those challenges. We also have a challenge of media and covering a wide reach across the region. So this was an effort to bring media outlets together to really coordinate on messaging, on outreach strategies, and to uplift the voices and stories of the communities of color who are not being seen and not represented in general market media, regardless of the population being close to 70% in this region of communities of color. So one of the big areas that we're working on is greater investment in community media. We want to rebuild and strengthen the trust that media has with our community and really double down on our strengths, particularly investing in ethnic media that has a specific reach into our communities, and really use this as an opportunity to mobilize folks to take action on key social impact campaigns. One of those was the census obviously last year, and we've been able to pivot onto other key issues. So we're really excited about that work, about its impact, and how it's helping transform the media ecosystem out here in the region.
Thank you. The transformation of the media empire, and it's been really interesting, and thinking about that loss of the local media in some respects, in those local stories with some of the consolidation. I feel like we could have a whole hour-and-a-half conversation just on some of those changes and how that is happening, but that is not what we're here to do today. But Courtney, really wanting to hear from your perspective on the health side. So tell us a little bit about the Missouri Foundation for Health and how you guys have been involved in this work. And I think some people might look at health foundations from the census, but talk about your work, please.
Good morning, good afternoon, everyone. I'm Courtney Stewart. I'm the Vice President of Strategic Communications at Missouri Foundation for Health. We are a regional change maker with a mission of eliminating the underlying causes of inequities, transforming systems, and enabling individuals and communities to thrive. In addition to our work on census and our COVID response work, we work on a number of issues. Our issues include infant mortality reduction, firearm suicide, firearm violence prevention, unintended pregnancy, childhood obesity, and many others. Through our programmatic commitments, through our health policy work, through learning and research, strategic communications, and convenings, we focus on the health needs of Missourians in 84 counties and the city of St. Louis, where we just voted in our first Black female mayor. I just have to say that. We're excited. Building infrastructure is just, I would say, part of our DNA. Not only are we doing it, I think, with our COVID work and what we did with census, which I will talk about, but we're in the journalistic space as well, building infrastructure with our partnership and our newly implemented Kaiser Midwest Bureau, our partnership with the Kaiser Family Foundation and Kaiser Health News. So I'll just check everything that Armando said about the importance of that journalistic infrastructure and the role that plays in getting support around your issues. So for census, our work was just across the board. It was health policy work, it was governmental affairs work, and it was really robust strategic communications work. A big win for us with our census work was the state of Missouri adopting our messaging. And that was through our partnerships and fostering relationships from the very onset of work, not just because, hey, we want to work on issues with census, we want to educate about census, so let's pick up the phone and try to pull people in. We've been fostering those relationships and building that type of infrastructure in our health policy department for a number of years. Who wants to scramble? You want to be able to tap and bring people in, and you want them to be enthusiastic about being a part of the work. And that's where we have our greatest impact. So civic engagement and building community voice in the field of advocates for us isn't driven by just one issue. I'll go back to what Karthik said about the boom and bust mindset. It's baked into everything that we do. When we were transitioning to COVID and thinking about how we could plug in with the infrastructure that was being built through our One for All Missouri Communications Initiative and Prepare STL Communications Initiative. How could we leverage other things? We had Medicaid expansion happening, we had census happening, we had voter concerns and registration going on, and then we had COVID, mitigating the COVID crisis, and then the vaccine on top of that. So let's not start over, let's build and get better and think about sustainability of that infrastructure from the onset.
Thank you. And that's, it's a perfect sort of transition to our next question. And, sort of each of you has engaged in work around COVID. So maybe Courtney, I'll start with you and just kind of ask you, what did you learn from these experiences, and maybe speak a little to how you've pivoted in this COVID work.
Definitely. We learned the power of partnership. We can't do this work alone. We just can't. So it's rooted in equity, and we need community, but we need the players of all sectors. So we need the chambers. We need for them to adopt the research that helps drive home the economic value of certain topics. And so when we were transitioning, Dr. James, into how we would respond to COVID, strategic communications, and I'm speaking from a communicator's perspective because that's my space, but strategic communications was just one area for us. We tapped into existing relationships across the state and played a huge role in coordinating, getting people to come together, talk to each other, and not be siloed or working on the same type of work in regard to the COVID response without just in their corners. And that's not easy. And even though we had worked on that really effectively with Census, and we didn't have to start over with COVID. It was a sale. So it was a sale for communications. Hey, you all are doing communications over here. Missouri Hospital Association is doing communications over here. You all are targeting this population and these zip codes, and we're all doing exceptional work. But can we come around and talk about it and share resources so that we can work smarter and not harder? And it's not about stepping on toes. We're all trying to save the lives of Missourians. So let's collaborate, everyone. Let's love on each other, everyone. So I think that was the biggest lesson for us. And just having that interwoven in just across the timeline, it's still going. And we're still having those meetings every week where we're resource sharing. We're talking about what you're doing. We're saying, what do you need? And then we're saying, hey, what's coming up? Let's prepare.
Yeah, I think we've seen similar things and trying to figure out connecting dots, but also figuring out what the dots are that are out there has been really an important piece in understanding who the players and are engaged in this. And as I said, working across sectors, stretching some of those partnerships and engaging with new partners who you have not. And I think, the chambers is a great one as well. So Juanita, what have you guys learned from this and how have you pivoted in this space?
For sure. I think I want to echo a lot of what Courtney said. One thing that we've learned is people that are a part of marginalized groups, that transfers over to every aspect of their life, right? It just doesn't stop at COVID. It doesn't stop at redistricting or voter registration or any of those points. And so we try to take a holistic approach, right? We're trying to meet people where they are and trying to ensure that we have trusted messengers that can bring them the information that they need. I feel like oftentimes people feel like organizations are self-interested as to why they're in their communities. Sometimes we come there when it's time to get their vote for certain things, or with the census, we want them to be counted, and you have to build trust. All of this is centered around relationships. And so really finding those people who are the trusted messengers in those communities to, like Courtney said, provide care to them year round. We have people at Boys and Girls Clubs that are giving backpacks to kids so that when it's time to give them information about COVID outreach, or when it's time to give them information about redistricting or anything, we don't have to look for them because they know us. We're in their community, and when they need information, they know who to come to for that information. And that's why it's so important not to do the boom and bust, but to invest in that infrastructure so that year round, these places are trusted places where people can go to get the information they need for them and their community.
Thank you. And I think, that leads perfectly, Armando, to information. And so, what have you guys learned in this, and how have you pivoted in this space around COVID?
Yeah, thank you. And this was really, obviously a very unique experience for all of us. But in terms of media, we began, several years ago thinking about the infrastructure piece, right? And like, how do we really develop the infrastructure for media, especially in areas that don't necessarily have a centralized media market, right? And that it's more disparate. But in terms of Courtney's point on partnerships, that was a key aspect because we learned that we can partner with media outlets. We can partner media outlets even in a very competitive environment, right? Competitive environment in terms of news coverage, in terms of storytelling, and in terms of resources, right? So we were working towards that as well, and just wanted to touch on that. But there was a really interesting and powerful continuity to our work because we were building for the census. COVID hit very hard around, almost a year ago, a little bit more than a year ago, where lockdown started specifically here in California. And so during that process, we had to integrate some of the COVID messaging, and it had impacted some of the groundwork here. So we had to pivot and really rely a lot on the media and the communications infrastructure that was built. Secondly, we learned that our approach, both our approach and our content and product, must be intersectional. So our approach must not, we couldn't afford, because of what was at stake, we couldn't afford just a unidirectional messaging approach where we're just putting out ads, we're putting out a story to see what happens. We had to really combine that work with what's happening on the ground, and it had to be reflective of the realities on the ground. So we had to make sure that was a key part of our overall strategy. And third, we learned that people are hungry and demanded trust for trusted sources of information. To Juanica's point, trusted messengers are, and we also learned to expand our notion of a trusted messenger, right? And influencers, right? It's not just having 1 million followers on social media, but there's trusted messengers and influencers in our community that we may be overlooking, right? So whether it's a local, advocate that has 10 to 20,000 folks that follows them locally, right? Or other professors or other community leaders that don't typically get the same light. We were able to identify that as well. And so all of this was essential into being able to pivot to both COVID safety work, and then also now transitioning into the vaccine equity work, and kind of using those lessons to build and to continue to engage communities on these critical issues.
Thank you. And so I'm going to ask one last question before we open up to the audience questions. So again, if you have a question, feel free to chat it, or I'm going to ask you to, you can also potentially raise your hand, use the raise your hand feature. But, this is a moment that we all recognize where things are being talked about differently. There's opportunity, I think, for us to do things differently and rethink. And we've talked about, as a country, having an infrastructure bill for many years, and we now have a proposal in front of us. And so as we look ahead and think about how do we make sure that we don't go back to business as usual, which I think many of us don't want to have happen, but are also recognizing we need to be intentional about that. What comes next for your organization and your work, and how were you thinking about what we need to be doing differently to make sure that we are getting to a more sort of just and equitable future? Maybe I will start that with Armando. Why don't we start with you?
Absolutely, and thank you. So for us, a lot of our work, and as I was thinking about this, a lot of our work is just continuing, right? Part of the infrastructure work is that we don't have to reinvent our system every time, right? Which is what is very helpful. Excuse me, I got too excited. But this work will continue. I see a ton of opportunities for growth in terms of the infrastructure, but in terms of public information and social impact campaigns that are coming our way, and a lot of them have been mentioned, right? Redistricting, elections that'll come our way, vaccine equity and access. But one of the things that we're really trying to nurture is, how do we embrace and nurture a communications and information ecosystem where we are able to provide reliable, accessible, intersectional information to all of our communities, right? And having like a nuanced approach to that. It won't be a one size fits all. And I think we're very clear about that. It won't be we're no longer in the space where it's going to be one outlet that covers everyone and that tells everyone's stories, but we have to embrace the nuance. And specifically, there's a couple key areas of consideration that we're thinking about in our kind of overall approach, especially on the funding and aspect, right? And it's thinking about our strategic communications capacity, right? I think that's like the first step, making sure that organizations, CBOs, and other partners have that capacity. But then it's also having a nuanced strategy and being able to put all of the components together. Being able to invest in earned media and earned media coverage, right? Telling the stories of our community. Oftentimes we'd like all of the media coverage to be free and for reporters to cover all of our stories. Unfortunately, we have to remember it's a business, right? It's an enterprise, right? So investing in paid media opportunities that isn't just ads, right? But it's really thinking about it more cohesively as an ecosystem. There's ads, there's stories, there's interviews, there's a lot that we can do with that. And then also identifying nonprofit journalism opportunities, nonprofit coverage that is also growing a lot in this area.
Thank you. And Courtney, I think, one of the things, obviously, what's next, we're all excited. You guys have a new president who will be taking the reins very shortly. But as you look to your organization, what's next for you all?
We do. We have Dr. Dwayne Proctor joining us May 3rd officially from the Robert Wood Johnson Foundation. And, he has spoken publicly about his plans and his vision to achieve health equity in 10 to 12 years in Missouri. So that's on the agenda for sure. And that's huge. But I think COVID and Medicaid expansion, I think census, all of this, but especially COVID, taught us a really hard lesson about public health. It smacked us in the face about how we need to prioritize that system and the disrespect that system receives when there is a problem. And it doesn't have to be that way. So we, as a change maker that happens to be known as a funder sometimes, we are going to take that on in Missouri. We've brought on a director of transforming public health on our team, and we are making some very significant investments in working with partners from every corner of the state to enhance public health in Missouri, and maybe make it a little bit more it's always been relevant, but it hasn't been as sexy as the other systems, and it's just as important, if not more. And we've added public health to our public affairs agenda, so there will be no barriers for us speaking out on the challenges that we face in the public health space in Missouri. And so we're forging ahead, and we're excited.
Great. And Juanita, what about you?
Hey, I think that we've, mentioned, all of us, we find the power in partners, right? And so for us, since we know that there's power in these partnerships, we think the missing thread was that often we work siloed, right? We'll have partnerships, but we don't exactly know what each person is doing. And you end up with, if you come from an organizer background like me, 4 door hangers on one door, right? When we could have taken one bite of that apple. And so it was really important to us in 2021 to make sure that our first order of business was to meet with all of our 94 partners. And we had them fill out an assessment of where are you going to be? What do your resources look like? Where are your gaps? Where do you need people to fill holes? What are your strengths? What type of trainings do you need? And now we have a database with all of this information from partners all across the state. So that was our first step, just getting that information so we can see where we could fill holes. Then realizing that a lot of these organizations do suffer from having a lack of funding, and they have boom and bust. And we decided that one thing we could do to help was to build an organizer school so that we could train people and keep people in the database for them year round and have a level set of like what it means to be able to, have best practices on canvassing, and especially in a digital age where there was a digital divide and a lot of people didn't even have those basic skills. So the table is providing those as well. It's just critical for the infrastructure throughout the state. So we're investing in that. We're offering convening spaces for advocacy and communications. There was a lack of C3 communication throughout the state. So the table's helping convene that space as well. Election administration, redistricting, voter registration. And we're just working really hard to combat disinformation, misinformation. We launched a fellows program so that we can get young people involved and make sure that they have stipends to be able to participate in the civic process. And we're trying to invest in the new generation of progressive leaders and just identifying unique and like innovative ways to engage people, also with data, right? Just showing what works and what doesn't work. And we're going to continue to monitor those gaps throughout the state. And we've put together some awesome resources so that when funders and people say, hey, what is going on in Florida? Where are those gaps? We're compiling all of that information. We have it. We can tell you where they are. And we think that just that knowledge is a great first step to finding some solutions throughout the state.
Thank you. So we have a couple questions from the audience, and I'm going to combine one that several people have asked in different forms, and then we'll take the one that Ms. Vin has around disability after that. But one of the questions that a lot of people are interested in is, how do we fund this and how do we make this sustainable in this work? So I will open that up to any of you who would like to answer that question.
I've been trying to answer questions in the chat too, because I see time is running out and I am paying attention. So if I don't get, because I see some direct messages, just email me. But how do you fund this? I think it's not a kind of one way. For census and for COVID, our communications work specifically, we took that partnership to another level and brought those organizations in to help us get the message out even further. So speaking of trusted messengers, and I think it's been said before, you can't just do the messaging work or do the strategic communications work and then say, hey, you all, we're the funder, use this. Their capacities of the capacities of these organizations, how they see communications, how their residents see communications, and how they are experiencing these issues. It's different. And so you have to pull in these organizations, make them grantees, give them funding so they can do the work. For census, we split it up in tiers, which was, it worked for us. We wanted to empower organizations to do their best work, but we know that everyone kind of may want to raise their hand, but may not always be able to make it to the finish line with the charge of the work. So with us building in a tier system with different ranges of funding and having requirements of how you could fulfill that tier, that worked for us. And then it was a tier 2. And if you're able to bring in these creative assets and push it out on social media and you can focus a lot more, then you're in this range. And this is how we want to work with you on this. So transitioning into COVID, we used our One for All Missouri and Prepare STL platforms, which are both community led and targeted for specific zip codes. We let them decide how they wanted to approach the work. What was the best way for them? Prepare, which is focused on Black St. Louisans and immigrants, they had a 3-prong approach. They wanted economic development along with their communications and outreach efforts, because when you're door knocking and you're going to community and you're pulling people in, you want to support them, and you know that they may have needs, and we wanted that to be a part of this work. Hey, we're not just tapping community, we want to support you all in community, and that was Prepare's approach, and it's brilliant. It's working for them. One for All Missouri, the funding, the way we approached the funding was different, but that's informed by our Missouri Department of Public Health, and it's informed in a different way. So it depends on what works for the geographic area, what works for the population, what works to get the message out, who are the message deliverers, how do we reach them, what's the research in Missouri, do we want to roll the research into what they're doing? It's so many different things, but just know that you have to be front and center with the partnership. It just makes it so much easier.
Thank you. And Armando, go ahead.
If there's time, yeah. I mean, if one of the things that I'm always thinking about is this information, or we're always thinking about is the information ecosystem. It's like, how are we investing in the long term communications and media impact of that region, and how our funding is gonna help nurture and support that. So it's investing in the CBO and communications capacity on the ground. I think that's very important, right? Folks and organizations need to be able to tell their story and know how to tell their story. But I think one of the areas that we're missing and we need to really think about is just funding media, and how do we fund media in a way that's strategically building power and capacity in that region to tell more of those stories, right? It's not just to tell this, like, just tell the stories that media wants to cover for XYZ reasons, but it's really telling the stories of our community, of the work that's happening, of the grantees, of folks on the ground, right? And I think that's really important. And then also, combining that with a strong digital strategy. We can't underestimate the impact of digital and social media, and how it's interwoven into all other aspects of media and communications as well.
If I could add one thing, I would say that I love my co-panelists because they give two other perspectives of this work, right? Because the only thing I was thinking this whole time, that one thing that would be great for funders to invest in, and oftentimes, we miss this because you're not in the community with these people, is like there's a whole bunch of organizations that do a lot of great work. We have a group, Family Action Network in South Florida, who was seeing 150 people a day in a target demographic. And they didn't have the van. They were just keeping these people in a spreadsheet. And they were like, oh, they come here for, food stamps, Medicaid, WIC, whatever. And I thought, wow, 150 contacts a day. Do you know how many phone calls people make to get 20 contacts? Imagine if we were using the local people in the community that actually have access to these people and bringing them into our fold, making sure that they're partners so that we could really tap into that. We'd save so much money. So when we talk about like sustaining resources throughout the year, I think we gotta like tap into those low-hanging fruit. Go back old school, like these churches that reach out to people all the time anyway. I think we'd get a lot more bang for our buck if we taught them those organizing skills and how to get that data back into a system that we could then turn those people around again later. So, and then attacking it from all of the other aspects that we're talking about. It takes 14 different touches, I think I heard, to motivate a behavior. So talking to them in the media and talking to them in church and talking to them at the Boys and Girls Club and them seeing it at the local mission and the person that's giving them the food, and really giving those people, investing in those people, giving them the skills and the technology they need to be able to track those people efficiently, I think is going to be great moving forward and how funders can really help.
Thank you. And we'll give the last question to Ms. Finn. So Eric, if you could maybe unmute Ms. Finn so she can ask her question. And if not, I can read what she's put in the chat.
All right. I know time is of the essence. Infrastructure is so important, right? And that's why we're all here. But if you're not at the table at the infrastructure, then you're going to miss out. So I'll highlight disability. Disability is most impacted in emergencies. You need the electricity to breathe. And if you're not at the table, that issue may not be raised up, right? Disability, if you're disabled and Black, your interaction with the police is even worse than if you're a Black person without the disability. You intersect mental health, and if you're Latino and disabled, poverty rate for you is even higher. So disability often compounds the issue, but often left out. So I was fortunate enough in California to be governor appointed in the census and brought it up. And so then we included infrastructure and got funding. But I worry about other states that did not just have that synergy. So I wanted to raise disability to see how we can include this population in the work that we do. Thank you.
For sure. I mean, at the table, like I mentioned in the beginning, the great thing about it is that we, our partners are from environment, disability. So what we try to do is in each one of those working groups that we have, we try to have representation from like different aspects and how it affects different aspects of the community. And so that we understand that that's a blind side, you know, for many of us. And so we do try to make sure that they're at the table, and including people from our disability caucus in those work groups as well.
And if I may add quickly to that one, I was just in a conversation with an organization here in the Inland Empire, the Autism Society, about this particular point. And we were creating digital and other media content to reach this population. And there's a lot of challenges, right? Because, you know, there isn't a way to target, folks that are differently abled, or like to really engage them. There isn't like a box that folks are checking on Facebook and saying like this, I'm part of this community, right? So really have to do both, have a broad message, have a more inclusive strategy overall, so that we're all engaged in that conversation, right? People shouldn't be external to that. And then also, I think that's where we really depend and really have to embrace our trusted messengers, because there's organizations on the ground, there's folks that are working with hundreds of people every day. There's agencies that we really have to engage to tap into these folks directly, right? And so I see a similar, obviously unique approach, but similar approach to the overall trusted messenger engagement strategy, right?
Thank you so much to all of you. I know we could have had this conversation go on for so much longer, but we do want to hear from you all in the audience in terms of the work that you're doing. But I do want to thank Courtney and Juanica and Armando for, first of all of the work that you guys have been engaged in, and the work and help that you're doing to reach these communities to make sure that they are connected, and the work that you'll be doing in the future. I also want to say that, you know, I'm glad to see in the chat, we've got some dots getting connected. So please make sure you are reaching out. And I see there's some more exciting stuff that's coming forward. So thank you all for the work that you do. And it's been my pleasure to have this conversation today. And I'm going to turn it over to Vince Staley, who's going to take us through a poll, and then we'll head into breakout sessions. So Vince.
Thank you, Kara, and thank you especially for moderating such a really rich conversation. Really appreciate the way you handle and tie everything together in a set of issues that are so complex and differing. So thanks for that. We want to hear from everybody who's participating in this discussion today, all of the registrants, participants. So we have a poll that helps us to understand, you know, what maybe also needs to be done. What are the blind spots? What are the challenges? What are the issues that we need to focus on in next steps going forward? So
first of all, thank you for everyone who has filled it out. And if you haven't had a chance yet, we're still collecting responses. If you just go to, someone can drop it in the chat. It's bit.ly/Civic Infra poll. So in terms of, what folks had flagged as extremely important, it is that multi-year funding and general operating support. A lot of things that are grouped under trust-based philanthropy. The thing that's missing in the middle there is technical assistance, improving government engagement, improving media engagement, and improving philanthropic engagement. So those, certainly also people are flagging as important, but these are preliminary data. Again, if you haven't had a chance yet, please do fill out the poll. Next slide. In terms of challenges to maintaining civic infrastructure, so it seems like generally people are saying that collective action problems and competing priorities tend to score a little bit higher, but you're also seeing a lot of folks flagging cost of infrastructure maintenance and focus on immediate needs. There's a lot that's come through in the open-ended responses as well, and thank you for filling that out. And I will turn it over to Maggie so you can stop the screen share. Eric, thank you.
Great. Thank you all so much. So I didn't say much at the beginning because I was very excited to get into our panelists, and now I think those of you who were with us know why. I think that, you know, this is the beginning of a really important conversation about how we value the work that happens at community level, that is really the mortar of what I think about as a participatory democracy. We learned it in the census work that we're doing. We're learning it as these tables continue to pull together across organizations, across domains, with media, with health, with all of those kinds of things. And we understand that that can only really happen at the community level, where trust is more readily built and sustained. If those businesses that are doing the work are funded, and funded in a way that is gives them ability to not have these bust and boom moments, but have the ability to sustain our communities and to do our work better, to do our work in ways that are smarter and kinder to the people that are in and of our communities. And so we ask you to stay tuned, to really think about supporting our work as we go forward, and ask even this administration to think about, as they're thinking about bridges and roads and buildings, that they're thinking about the civic infrastructure as an incredibly important piece. I thank you for the breakouts. I said in my breakout, I love days like today because I am so honored to be among the company of all these, well, the Episcopalians say of all the faithful people, but I will say of all these amazing practitioners across the field. We hope that you will stay together with us as we continue this conversation and the work in service to our communities.